Hello, everyone. This is our presentation for Lisinopril. It's going to be by Alina, Sadie, me, Leticia, Elizabeth, and Kua. So the brand name is Lisinopril. The generic names can be Prinaval, Zestrol, and Cubrellis. Therapeutic class is an antihypertensive, and the pharmacological class can be an ACE inhibitor. The mechanisms of action. ACE inhibitors block production of angiotensin II, which decreases vasoconstriction, thus having vasodilation effect, and decreases aldosterone production, reducing retention of sodium and water. Here's our first NCLEX question. Which statement best describes how ACE inhibitors work? Select all that apply. A, ACE inhibitors cause positive and negative chronotropic effects on the heart. B, ACE inhibitors prevent the conversion of angiotensin 1 and angiotensin 2. C, ACE inhibitors prevent the production of aldosterone. Or D, ACE inhibitors cause hypokalemia. Give you guys a few seconds to choose which one. And our answers are B and C. The therapeutic use, dosage, and route of administration. For therapeutic use, it is for hypertension. The dosage is an oral solution or tablet. For oral solution, it can be 1 milligram per milliliter. And for tablets, it can be 2.5, 5, 10, 20, 30, or 40 milligrams. The route of administration would be oral solutions or tablets. Some adverse effects for the CNS, it causes headaches, dizziness, syncope, vertigo, and paresthesia. For the cardiovascular, it causes orthostatic hypotension and chest pain. For ears, eyes, nose, and throat, it can cause vision changes, tinnitus, and nasal congestion. GI, it would cause diarrhea, constipation, flatulence, nausea, and dyspepsia. For the GU, it can cause impaired renal function or impotence. Metabolic, it can cause hyperkalemia or gout. For respiratory, it can cause dyspnea or dry cough. And the skin, it can cause diaphoresis, arrhythmia, alopecia, pruritus, and urticaria. For frequency and duration of administration, frequency for adults, it's 10 milligrams by mouth daily without diuretics and do not exceed 40 milligrams. The frequency can be increased based on the patient's response and the tolerance on the medication. And if the patient is taking diuretics, do not exceed over 5 milligrams daily. The duration of the treatment onset is 1 hour. The peak of it is 7 hours. It can last 24 hours, and the half-life would be 12 hours.
All right, pharmacokinetics. So lisinopril is water soluble and it's not protein bound, so it's able to act quite fast. It's absorbed in your intestine and it has a pretty low bioavailability compared to other ACE inhibitors. You're going to get your peak plasma in 6 to 8 hours. And some sources say take it with food, some say take it without. My source showed that it was not clinically relevant if food affected absorption or not. But as we know with oral medications, it's best to take it on an empty stomach so you can maximize absorption. And it is not, there's no first pass effect from the liver. Lisinopril does not need to be metabolized in order to be active, and it is mostly eliminated. Almost all of it's eliminated through your kidneys, with the remaining being through your stool unchanged as lisinopril. Also, it is eliminated from your plasma fully in 12 hours. Now, pharmacodynamics. It's going to inhibit the conversion of angiotensin 1 to 2. So this is going to cause that relaxation in your blood vessels, thus decreasing your blood pressure. It also has a role in the RAS system because it's going to decrease testosterone secretion, causing you to lose sodium through your urine. And there may be a slight increase in your potassium levels, so it's good to monitor for hyperkalemia. But through this reduction in aldosterone secretion, it's going to decrease that blood volume further, um, giving you that antihypertensive effect. All right, now for pharmacogenomics. So, genetic variants in the AGT, the REN, and the ACE2 genes were associated with failure to achieve 10% systolic blood pressure decrease due to lisinopril. That 10% was the parameter for drug efficacy. So they determined that larger studies were needed to determine if there was in fact a specific gene that affected the effectiveness of lisinopril. Also, incidence of ACE inhibitor-induced angioedema is 5 times greater in people of African American descent, leading researchers to try to parse out a single gene that was responsible for that. They had several studies that were published that had candidate genes, but ultimately, there was no genetic variants with sufficient effect to be clinically useful.
NCLEX question number 2. The nurse is providing patient education to a client. Which response from the client indicates the client understands when they must immediately contact their provider? Select all that apply. A, I will notify my provider immediately if I have dry eyes. B, I will notify my provider immediately if symptoms of kidney damage occur, including blood in the urine, difficulty passing urine, changes in the amount of urine passed, and significant weight gain. C, I will notify my physician if I experience symptoms of hyperkalemia, which include irregular heartbeat, confusion, weakness, lightheadedness, dizziness, fainting sensation, tingling or numbness, or dyspnea. D, I will notify my provider if I experience symptoms of hypokalemia, such as muscle spasms, tingling, or numbness. The answer is B and C. Health inequities related to lisinopril for pediatric patients would be that there are no significant age-related drug issues for children between the ages 6 to 16, but there has not been enough studies done on patients below the age of 6. For geriatric patients, they respond well to the medication. However, elderly patients are more likely to have kidney-related issues, which may require an adjustment in medication administration because of lisinopril's effect on the RAS system. Health inequities related to breastfeeding is that there's not enough studies done on breastfeeding women to assess the harm to the baby's development when taking this medicine while nursing. The presence of this drug in human milk is unknown. The patient should stop taking their medication or breastfeeding. The prescriber must evaluate if the benefits of the medication outweigh the adverse effects. For pregnant women, lisinopril damages and even kills growing fetuses by acting directly on RAS. As soon as pregnancy is suspected, discontinue the medicine and notify provider. Health inequities related to gender is that there's no age or no sex-specific treatment recommendations in current guidelines. New research indicates that differentiating medication dosages may be helpful. Women may experience similar effects from lower doses of angiotensin receptor blockers than men do, suggesting the possibility for men or for more individualized dosing strategies. Health inequities related to race and ethnicity is that African patients are at a higher risk for angioedema. African individuals using an ACE inhibitor alone experience a lower reduction in blood pressure. For a better outcome, Black patients should take their medication with a thiazide diuretic.
On to physiological response. So lisinopril is an ACE inhibitor, so it does block the conversion of angiotensin 1 to angiotensin 2. And this, of course, as mentioned earlier, causes vasodilation of arteries, decreased aldosterone release, which leads to increased sodium secretion, increased potassium and hydrogen reabsorption, so making you become more acidic, decreased thirst and ADH levels. It also inhibit the the inhibition of ACE inhibitors also increases the formation of bradykinins in the lungs. So the bradykinins is what leads to the vasodilation and improved vessel permeability, which can lead to the angioedema. And bradykinin also irritates the lung, which is responsible for the dry cough that you experience with this drug. Developmental. So there are limited studies that suggest that lisinopril is effective, or the efficacy of lisinopril for children under age of 6. So typically is used for children 6 and over, but there is careful consideration, of course, their height and weight when prescribing this medication. And as mentioned earlier, the black box warning on pregnant women taking this medication as well. Psychological effects. So lisinopril has been shown to cause some psychological effects in some patients, including insomnia and anxiety, and of course, the adverse effect of the central nervous system of dizziness, headache, fatigue, syncope, and vertigo. So there is no risk for addiction with lisinopril. It is covered by most insurance. Sorry about that typo, including Medicare. Even if they need to, the out-of-pocket cost is usually pretty low. There has been a downward trend from 2004 to 2022, according to Statista, with the average price out-of-pocket cost for lisinopril at $3.93. Cultural factors. Lisinopril is considered to be less effective in African Americans, and although they do, it's not completely out that they can't take it. They usually are. If need to, they can, but they usually require some thiazide to go along with it to achieve therapeutic effect. And lisinopril is usually mostly ideal for young white male patients.
In order to monitor the therapeutic effects of lisinopril, we can look at labs in radiology. A CBC and a CMP should be done, and the main ones to look out for would be potassium, blood urea nitrogen, and serum creatinine. So for potassium, lisinopril can cause an increase, which would cause hyperkalemia. Some signs and symptoms to look out for would be fatigue, weakness, nausea, and abnormal heart rhythm. For blood urea nitrogen and serum creatinine, these are important to monitor because they show the effects of lisinopril on the kidneys, which is decreased renal function. Also, white blood cells should be looked at before therapy and then every 2 weeks for the first 3 months of therapy. Lisinopril can also slightly lower hemoglobin and hematocrit, and then it can also cause hypoglycemia due to lisinopril's ability to improve insulin sensitivity. So we should especially monitor patients with diabetes mellitus, especially if they're taking insulin. And then it's pretty rare, but ACE inhibitors have been associated with liver failure. So we would just want to keep an eye on liver function tests like ALTs and ASTs, and also bilirubin. And then we should also monitor for hypotension. And also lisinopril has been shown to cause angioedema, which is the quick onset of deep swelling under the skin. This can show up in the eyes, lips, head, or neck, which is especially should be monitored because it can compromise the patient's airway. It can also show up in the intestine, and this would show up as abdominal pain. And here shown is a CT scan of a patient that has angioedema in the small intestine. You can see that in the red arrow. And then especially for CT scans, we should hold lisinopril, especially because of the contrast dye. If these are used together, it could cause renal damage.
All right, question number 3. Who is the best candidate for lisinopril? A 25-year-old 8-month pregnant woman with gestational diabetes and high blood pressure, a 26-year-old white female with stage 1 hypertension and a history of hyperkalemia, a 56-year-old black male with stage 2 hypertension, or a 46-year-old white female who just experienced heart failure. All right, and the correct answer is D. Lisinopril is used for patients post-MI or heart failure. in order to prevent future occurrences, and it can also help with recovery.
So telehealth is a really great tool that patients who are taking Lisinopril can use. They can talk to their provider and monitor their blood pressure at home. They can purchase a blood pressure machine from a medical store. They should also take their blood pressure at the same time every day, in the morning and at night. And they can record their blood pressure to update their provider on any trends that they can see. And then patients can also prescribe and refill medications like Lisinopril and adjust dosage depending on the trends in their blood pressure. The provider can also give lifestyle tips such as weight management, reduced salt and fat intake, exercise, smoking cessation, and nutritional diet for the patient. They can help them come up with strategies together. A common one is the DASH diet, which includes vegetables, fruits, whole grains, low-fat dairy, poultry, beans, nuts, and fish. It limits saturated fats and foods high in sugar. The DASH diet stands for Dietary Approaches to Stop Hypertension. Studies show that people of all ethnicities benefit from this diet, and it may decrease blood pressure by 11 millimeters of mercury. The benefit of telehealth is that it makes it more accessible and cost-effective for patients. It can be done from the patient's home without having to go to the provider's office, and it also provides open communication to promote beneficial patient outcomes.
So Lisinopril is not considered a scheduled drug under the DEA. Therefore, any licensed healthcare professional that has a prescriptive authority can prescribe it, such as your MD, your DO, your pharmacist, PA, and CRNAs, to name a few. Lisinopril is generally pretty safe, although careful consideration should be focused on the patient's potassium levels and renal function when taking this medication. And usually this patients who are taking this medication require a interprofessional communication between all healthcare professionals to make sure that the patient is receiving optimized care. And Lisinopril is approved by the FDA for use and management of hypertension for adults and pediatrics age 6 and older. It's also used as adjunct therapy for treatment of heart failure. And is also a treatment for ST or STEM myocardial infarction for hemodynamically stable patients. It also has other off-use approved use, such as diabetic nephropathy, proteinuria, which is used and may provide adequate control, and post-transplant erythrocytosis. Healthcare policy. So it is, of course, the nurse's policy to understand the policies and procedures of their respective healthcare facility before administering any drug and medication. This includes Lisinopril. And of course, the nurse should pay careful consideration to the patient's blood pressure, especially, but usually also as well heart rate before administering Lisinopril. And of course, be sure to follow your rights of medication administration.
Lastly, while administering and the patient taking Lisinopril, we should address the client's rights and ethical standards. Just to be reminded, the rights include the right to education, right to refuse the medication, right to assessment before giving the medication, and the patient has the right to ask questions concerning Lisinopril. And then some ethics just to keep in mind are beneficence, which is the duty to promote the good of others, non-maleficence, which is to do no harm to patients, the autonomy of the patient, so they have the right to make decisions. It's important to be truthful, and also the patient should be able to give consent to a procedure concerning anything that might be needed when taking Lisinopril. And then here are references. Thank you for watching.